and be ready to go. On the Move with Palesa and Benjamin Moshatama.
Well, there's evidence suggesting that some girls in Africa, particularly in urban areas, are experiencing puberty at an earlier age than previous decades. Although there's still a little bit of work that needs to be done, research and more systematic data collection and research to fully understand this, there seems to be a trend that is happening in urban areas. It's not universal, it varies based on factors like location, socioeconomic status, and ethnicity. However, we have research in countries like South Africa that has shown a decline in the average age of first menstruation amongst urban black girls. But it's very different and it's very multi-hued on the African continent and how it looks like. To speak on this, we're joined by Dr. Jacqueline Kisia-Nyale, who is working in Kenya's Ministry of Health in the Division of Maternal, Neonatal, Child and Adolescent Health. Dr. Jacqueline, welcome on the show.
Thank you very much, and thank you for having me.
Let's start with this one. Is it a fact that girls in general are experiencing puberty, or is there a lot that still needs to be unpacked around this matter?
Yeah, this is actually very true, as you said, especially in the urban area. We are seeing a lot of obesity, and obesity does give excess body fat, which leads to increase of estrogen, which produces or triggers early puberty, and also endocrine disputing chemicals, which also trigger early puberty. These are found in products like cosmetic, plastic containers, pesticides, and those kind of things. You'll find which in the urban area, they're actually being used quite a lot. We also need to look at genetic. Family history plays a significant role, and diet and nutrition, processed food, sugar, unhealthy fats, which contributes towards obesity, and which leads to early puberty. Social influence, culture, expectation, media portrayals, that is social media, where you get like young children have access to maybe pornography or something which is so sexually oriented, and that also will influence their development into early puberty. Stress also is plays a big role. Chronic stress can impact hormonal imbalance and also develop potential which will lead to early puberty. And environmental factors like exposure to certain chemical pesticides and antibiotics, which are usually used in products like poultry and in meat or during the farming. So they use pesticides or antibiotics on products like the chicken, and all that will lead to early puberty.
Dr. Jacqueline, is there a reason why parents should be worried when they realize that their child is going through early puberty?
Yes, because we need to give our children life skills whereby they know what to do and what not to do. And also we have, as parents, we have to be present to parent our children, protect them, and provide knowledge, awareness on what can happen. Also, the government needs to step in because There's the HPV vaccine, which needs to be given to a 9-year-old according to the WHO guidelines. But if puberty starts around 7 years, then this child could be sexually active. And we are trying to prevent cervical cancer in future. And that will not happen because you cannot prevent after the child is already sexually active. We also need to look at our age-appropriate knowledge so that we can start early enough to pass this knowledge to our children as life skills so that they don't go into situations where they're sexual active and end up in unwanted pregnancy, HIV, and sexual transmitted diseases.
Yeah. Let's talk a little bit about that element of access to sexual material. How is it related to puberty?
It triggers. You look at pornography, you activate some of these hormones, and either the child will start wanting to get involved in sexual activities. And that also triggers the hormonal production. Then the body starts developing now as a woman and the body does not relate with the mind because the body has already developed, but the mind is still for a child.
Yeah, I mean, that's so interesting. I mean, that also takes us back to a question maybe we didn't ask, and maybe my apologies that we didn't. What age is too early?
Age which is too early is around 6, 7.
Okay.
8. Okay, for girls, we look at us from 9 to 13. That's okay.
Okay.
For boys, 11 to 14, that's fine. But when it's too early, it's like around 6, 7, 8, and breasts have started developing, pubic hair has started growing, and men start looking at them in a different way. Like, this is not a child, this is a woman we can have sexual intercourse with.
Okay, we need to take a break. You're giving us some very interesting thoughts there and very important insights, because some of the indicators that you highlight are probably ones that we would take for granted. Stay there on the line, Doctor. We'll continue the conversation after the break. We're speaking to Dr. Jacqueline Kisia-Nyale, working in Kenya's Ministry of Health in the Division of Maternal, Neonatal, Child and Adolescent Health. And we speak about why some girls, especially in the urban settings on the continent, go through puberty much earlier. We'll continue the conversation after the break. It's 20 minutes past 11 o'clock Central African time.
Africa, meet Abedi.
Yeah, that's me.
Abedi is a music lover through and through.
I really love African music.
He's got a taste for all kinds of tunes and spends his days listening to Channel Africa. Guess what? He didn't know.
Okay.
Channel Africa wants to help Abedi and all music lovers everywhere to discover even more incredible music. That is why Channel Africa is calling on all African musicians to submit their music. Musicians, remember to give us all your relevant information. Make your submissions at music@channelafrica.co.za. Submissions are your chance to be heard on radio. But sadly, they do not guarantee that you will be playlisted. All submissions will be carefully reviewed to see if they meet our station's requirement. Channel Africa, the African perspective.
It's 21 minutes past 11 Central Africa time. You're tuned into On the Move. We're speaking about why more and more young girls in the African urban settings are experiencing puberty early. And this is a very important conversation to have as, our guest has mentioned quite a number of contributing factors to early puberty. Dr. Jacqueline Kisia-Nyale, working in Kenya's Ministry of Health in the Division of Maternal, Neonatal, Child and Adolescent Health, continues this conversation with us. Dr. Jacqueline, you gave us quite a number of contributing factors to early puberty: the food, the environment. You spoke about plastics and even an introduction to sexual content at a young age. When a parent sees that their child, who's maybe 6, 7, 8, like you mentioned, would be early puberty, has started their period or has started puberty, how can they pinpoint that contributing factor so they can add some lifestyle changes?
When that happens, it's very hard for a parent to pinpoint what exactly, because sometimes could be it's genetic, could be it's due to obesity. My advice is the parent should just be supportive, because some of these parents usually feel like this is a disaster.
Yeah.
How am I going to handle my kid, my baby who is already a woman? Do I leave my job so that I can look after this girl or this baby 24 hours? I'll give you an example with myself. My daughter started developing at the age of 8, and me and the dad, we are both in the medical field, and we panicked. We were like, what has happened? There must be something wrong. We went to see an endocrinologist because we had panicked. Maybe she has some kind of disorder. And we were just told this is just early puberty. And as you can see, maybe you've been using a lot of processed food. There's a bit of obesity. So the fat also triggers some hormones, which will definitely lead to some of these body changes. The pubic hair, the breast development. And the doctor who we went to see was telling us, you just need to be supportive to your daughter, because once you make a wrong move, it will affect her all through her life. So my advice to parents, it's like to embrace, because it's already here. And if it's before that, try and go tradition food. And the processed food is not actually good for the human body, like I would say, in terms of when a child is growing up, because we're already dealing with a lot of obesity, lifestyle diseases. So if we start at that young age, we'll be dealing with a lot by the age of 30, 40, compared to now, where we are dealing with lifestyle chronic diseases at the ages of 50, 60.
And what would that support entail that you're talking about? Because, young girls and boys who are going through early puberty probably are going through a lot of emotional and psychological changes at that time of their age. What do you do to give them that support as a parent?
Just show them love. Tell them it's okay that their body is changing, and to talk to your child when he's being bullied in school, either by the teachers or by the peers, because a lot of bullying happens with their peers. When they see like a girl has started having breasts, and they would be like either tease her or sexually abuse her. especially when it comes to teachers, especially when it comes like to older students. They are on body shaming.
Yeah.
Or telling them that they're abnormal. So that affects it. It might look like a very short phase, but it affects them all through their lives to their adulthood, because such comments will really, really bring some mental issues, depression and anxiety.
You know, Dr. Jacqueline, there is the physical aspect, of course, of early puberty, but there's also the psychological aspect, which I think many parents and guardians would struggle with the most, because once you realize that your child is going through early puberty, these are 6, 7, 8-year-olds. They hardly know their numbers. They can hardly, read coherently at that time. How do you have a conversation with them so they can understand what's going on with their bodies? I'm sure it would be much harder to try and explain to a 6-year-old how to use sanitary towels.
I will talk about what we have done in the Ministry of Health in Kenya. We have developed a booklet which it's about understanding adolescence. And this is a booklet which an adolescents can read to understand their body. And we are in the process also of developing a parent, teachers, and caregivers guide on understanding adolescence. Apart from that, we get into forums where we create awareness on how to treat an adolescence. Even in our health facilities, we have youth-friendly or adolescents-friendly services facility where they are treated a bit different away from the adults, and how to address their issues, because adolescents and youth prefer privacy. But remember, this 6-year-old, 7-year-old, and 8-year-old cannot come to a facility alone. This is a child. This is a baby. So we work with the community health promoters at the community level to educate the teachers, the parents, and the caregivers on how to treat adolescents. Self-care.
Yeah.
What are the signs which you are going to look at and make sure your child is well taken care of? Let's say they start their menses early. Provision of sanitary towels, because poverty also, it's in Africa and it's everywhere. Some of these countries you can't even get sanitary towels. So we talk to the parents in different forums, in churches, in mosques, in temples, in barazas, where the chief, the local leader is going to hold meetings. We try and bring up some adolescents, youth-friendly information.
All right, we'll have to leave it there. Thank you so much for this very informative session. And I think it's great because you've been informing us as a medical professional, but also as a parent who has also experienced their child go through early puberty. It was also great to hear that one-on-one perspective of this conversation. Thank you so much for your time.
Thank you so much for having me. I really, really appreciate.
That is Dr. Jacqueline Kisia-Nyale, working in Kenya's Ministry of Health in the Division of Maternal, Neonatal, Child and Adolescent Health. The conversation there was early puberty for girls. That seems to be, more common in Africa, especially in Africa urban areas. It's 11:30 Central Africa time.